So good afternoon, everyone, and thank you for joining us for this NAMI Greater Cleveland psychoeducation webinar, Navigating Health and Mental Health as a LGBTQ plus identified person. We are very happy to be joined today by Emerson Douglas, who is the presenter for this program. A few words as we get started. Please be aware that this webinar is being recorded and will be posted to the NAMI Greater Cleveland YouTube channel later in the week. I will also be making the slides available to you in an email after this presentation, so you can have those. We will also ask you to complete an evaluation at the end of today's webinar when we end by about 1 o'clock. Please remain muted throughout the presentation. Please utilize the chat feature if you have questions. We want to make sure that we're able to address the most relevant concerns and inquiries you may have related to this topic that motivated you to attend. If you're not familiar with NAMI Greater Cleveland, we are the National Alliance on Mental Illness. At NAMI Greater Cleveland, we serve Cuyahoga County specifically, and our mission is dedicated to improving quality of life for individuals with mental illness and their families. And we do that by providing education, support, information and referral, and advocacy. And we are very happy to provide monthly webinars on special topics related to mental health to all of you that are free and open to the public. So with that being said, I will hand it off to Emerson to begin the presentation. Thank you all for being here.
Hi, everyone. My name is Emerson Douglas. My pronouns are he, him. And this is start of my presentation. I'll go ahead and go on to the next slide where it's a little bit about introducing myself. So one of the things that I'm passionate about is lived experience. And what lived experience means is your experience of, with certain identity, with certain experiences. So, and I really think that there's value in bringing that into the therapy room so then patients and clients can feel a sense of solidarity. So again, my pronouns are he, him. I'm a therapist in Columbus, Ohio. I'm a social worker by trade as well. And with my lived experience, I am queer, I am transmasculine, and I do have some lived experience with mental health, being a trans person needing to navigate the mental health system to receive gender affirming care, which is something that I will talk about later in this presentation. Some of my values include social justice. Again, social worker by trade. I don't believe that you cannot extricate social justice from being a social worker, right? Those are just like two very intertwined things. And I'm very passionate about helping clients navigate those systems of oppression in my practice as well. Other values, bodily autonomy, which I'll talk about a little bit later, specifically related to providing mental health letters for trans folks to get gender affirming care, that, clients are the experts of their own body and know their own experiences. And then finally, being sex and gender affirming. Definitely those values really shape my practice. So the first thing I want to talk about is for LGBTQ plus identified folks, what are some common concerns with them seeking care? So seeking care, meaning medical care or mental health care. The first one that comes up is previous negative experiences in seeking care. So a lot of the folks that come to receive therapy services with me, they've had negative experiences before. I hear folks saying my therapist really didn't understand my gender identity or my sexuality or focused too much on it. Or, I went to the doctor and they just didn't understand me and, kind of sloughed off all of my concerns and were just concerned about my identity. And I'll talk about some of those things later and kind of like theorizing and putting vocabulary to those different experiences. Something else. So just kind of imagining you're going to a therapist, it's a very vulnerable thing. And then as you're checking in or as you're meeting your therapist, you're automatically misgendered or dead named. And that can make you feel off for the rest of the session, not being able to be fully in the moment and getting the care that you need. That's also something that I hear folks saying. And a third really important thing is being uninsured. People who are LGBTQ identified, there are multiple reasons and environmental factors that can contribute to being uninsured. Another term is underinsured. So this also fits a lot of folks these days, where you have a mental health care, or you have a healthcare plan, an insurance plan, and perhaps you don't have mental health care benefits, or perhaps you have a very high deductible, $5,000, $10,000, where until you meet that deductible, you have to pay out of pocket. And that can be really inaccessible for folks. Another concern is lack of providers in the area. Imagining that you're living maybe in rural Ohio and not having any affirming providers near you. What has kind of been something that is a silver lining that has come out of COVID, if there ever can be such a thing, is that telehealth has become much more accessible. So a lot of the clients that I see currently are all over the state of Ohio. And I'm really honored to be able to serve them when they wouldn't have any affirming providers in the area. The next thing I want to talk about is intersectionality. So this is, right, the assertion that social identity categories, race, gender, sexuality, disability, class are interconnected and operate simultaneously to produce experiences of both privilege and marginalization. So kind of fancy ways of saying that everyone has identities that overlap. And that could be potentially me as a white person and a transmasculine person, where being transmasculine has, marginalization effects, but also I pass through this world, pass being in quotations, as a cisgender male, white male specifically. And so for folks who have like multiple layers of identities potentially in those marginalization categories of, potentially being a person of color and being queer and being trans, this can all multiply in those layers of discrimination and stigma. So some of the effects, which I'll talk about in the next slide, one of them is misdiagnosis of, that there's racism and cissexism and heterosexism kind of intertwined in our systems of care that can affect people's abilities to get care and even lead to misdiagnosis. It can lead to bias of, expecting someone of this certain identity to present a certain way, and that is just kind of automatically the category that they're placed in. So an example of this, first I'll go to this here. So example, there was a Black autistic trans man that I knew trying to access gender affirming hormones. So in order to access gender affirming hormones, you have to go through seeing a mental health therapist or seeing a psychiatrist even. And for him, he was actually misdiagnosed with schizophrenia, which a lot of us know is a very stigmatizing diagnosis. That diagnosis, quote unquote, follows him in his medical chart because that is, the term that folks use as a serious and persistent mental illness, which again is stigmatizing in of itself. That is going to be in his chart and really, be shared with any provider that is going to see that chart. Why did this happen? So both being autistic and being Black, someone who's autistic has certain traits of, potentially not being super great with social situations or having, experiences of needing to stim. So maybe, he's kind of shaking his hands or something like that to be able to be in the present moment. And he was misdiagnosed, and not only did that, does that diagnosis follow him, but it also prevented him for a long time of being able to access hormones. So, there is evidence of racial bias, both in clinicians and diagnostic criteria. So history kind of wise, Black folks being perceived as mistrustful or paranoid or violent, and that can actually be seen in kind of the evolution of diagnoses and what's in the DSM's Diagnostic and Statistical Manual of Mental Disorders. And so due to this, there's almost a cyclical process that goes on. So due to mistreatment, due to being perceived this way, due to, okay, automatically I'm going to diagnose you with schizophrenia, Black patients are mistrustful of, mental health providers. So then as they are mistrustful, they might act in a way that is perceived as paranoid and is perceived as mistrustful because they are afraid and are trying to navigate what it's like getting this care and being perceived this way. So then that leads to a perception of paranoia by the clinicians again. It's this cyclical process. And it's because of this person who just happens to have these overlapping identities. And so it took a long time for him to finally be able to see a provider who says, oh, these are actually traits of autism and not because you have schizophrenia. In the past, people have been diagnosed with schizophrenia just for being trans, of like, this is some perceived as some type of delusion that they don't know who they are. So that can definitely be something that we're dealing with. So what does this all kind of show us? So this is a framework called the Health, Stigma, and Discrimination Framework, where it kind of outlines this process. So if we go, down here to the bottom, drivers and facilitators. So we have all of this, these cultural norms, and we have legal environment, health policy, we have stereotypes, prejudice. All of these things lead to something that's called stigma marking, where those intersecting stigmas, we talked about intersecting identities, right? But there's also intersecting stigmas of even health condition related stigma. Someone who does have schizophrenia, there is stigma related to that. And then also we, kind of tack on top of that race, gender, sexual orientation, class related stigma. It leads to these manifestations of that stigma. So manifestation of that stigma would be like this Black autistic trans man being misdiagnosed with schizophrenia. So because of how the providers view this person, not just because of the providers, but also, underneath how racial bias is kind of intertwined sometimes with mental health care. And then this leads to kind of on the other side, stigma experiences of that person. They can experience internalized stigma, so feeling really bad about himself, not wanting to pursue any more care because of obviously being treated very poorly, discrimination, even anticipated stigma. That kind of thing that I was talking about earlier with, previous experiences of being treated poorly in mental health and healthcare. So then what does this lead to? It leads to outcomes where there are, affected populations, affected folks who, want to, we want to improve this, right? So adherence to treatment right now, and before, and I was talking about this Black trans man, he was experiencing that discrimination. And so in this outcomes category is actually what it says on the side. You kind of have to turn your head. Key areas for national monitoring. So how can we improve these outcomes based on these intersecting stigma? How can we, improve laws and policy, social protections, advocacy? So it's just a way of framing how all of this works. So kind of taking into consideration, intersectionality and those stigmatizing experiences, right? Experiences of stigma. There's a colloquial term in the trans community called trans broken arm syndrome. And so what this is, as you kind of see in these examples, is a experience of explaining this is you go to the ER with a broken arm. You straight up have a broken arm and you need to fix that broken arm. You go into the ER, the doctor says, oh, your broken arm, that must have to do with you taking hormones. And obviously, like, that's maybe not actually going to happen, but something similar happens to trans folks like that a lot. So also maybe a more common one, you're presenting to the ER with a broken arm and the doctor starts asking what genitals you have, because of this morbid curiosity about your identity. And your genitals have nothing to do with your broken arm. So putting it kind of in official terms, what is this syndrome? It's the incorrect and explicit misattribution of gender identity or medical transitioning as being the cause of an acute complaint, or an invasive and unnecessary questions regarding a person's gender identity or gender transition status. So, that's just an example of what trans folks have to navigate. So we're going to talk a little bit about healthcare. So going to the doctor and how to get affirming healthcare based on all that we've understood about intersections of stigma and discrimination and experiences. So assumptions. So talking more about experiences of people receiving healthcare who are LGBTQ. Basically, one of the main things is providers and institutions assuming that all patients are heterosexual or cisgender. So on the right there, you see, a little picture of like a medical chart, right? In that medical chart, or in a form that you're filling out, maybe there's a question about relationship status. And, the only questions there are, are you married? Or are you single? And for, a lot of folks, I mean, even just cisgender and heterosexual people, they might not be married, but they might be in a partnership. Or for folks who are polyamorous, who have more than one partner, that is not indicated there. So sexual health. Someone, is assuming based on how you're presenting who your sexual partners are. So again, assuming all people are heterosexual cisgender, a person like me who is going to the doctor, maybe someone is assuming that all of my sexual partners are women just because I pass as a cis heterosexual man. But I'm not, I'm a queer person. And so I might have partners of different genders who I am, being with. Also something on a form, right? You see the question, are you pregnant? And it says for women only. Or, when was your last period? For women only. For trans men who are assigned female at birth, trans men still can get pregnant and still have parts of their body also that potentially you're still having menstrual periods. So this kind of goes into, hand in hand with this idea of women's or men's health. Say you're a trans person, trans man like me, needing to go to the gynecologist to get a pap smear, right? And I'm sitting in a room that is labeled women's health, and how, just stigmatizing or just uncomfortable that can be. And for folks maybe who don't quote unquote pass as well as their experienced gender, or are non-binary and also do not identify as a woman, just that experience of being in that room where it's called women's health when you are not a woman. Going back to like parts of the body that need preventative care, instead on a form of saying, women's, is this, for a woman only, something that I've seen is, it sounds maybe a little bit weird, but like an organ or a body part inventory of like checking off what body parts do you actually have, instead of just that being assumed based on how you look. So, I would check off that I still have a uterus. And, based on whether I've had top surgery or not, I could check off whether I do need a breast screening for breast cancer. So going on to the next point, just having medical forms that don't have options to represent you. So also having to endure, as talked about before, misgendering or dead naming as you're in the healthcare provider's office before you even get to seeing your provider. You're already kind of on edge because of this misgendering, or you've tried to explain to the front desk person, please use this name, even though it's not the same as my insurance. So yeah, some really tough stuff. All that to say, how do you find affirming care? The number one thing that I suggest to people is searching for local LGBTQ clinics in your area. So even just the simple process of Googling LGBTQ clinic near me in Google. Often Google is pretty good at understanding what your location is, or you type in your area, LGBTQ clinic, Cleveland, Ohio. Or you can even type in something like LGBT doctor, Cleveland, Ohio, or, transgender doctor, Cleveland, Ohio. And those clinics that come up, I'll explain, some examples in a couple of the next slides, are often clinics who are specifically invested in providing affirming LGBT care. Another thing, and is maybe potentially even more important than the first one of Googling, is if you have an LGBT community, asking your community of their recommendations. Just because you find an LGBT clinic doesn't mean that, one of the providers that you're matched with, you're going to have the best experience for your identity. So being able to ask your community about, based on my identity, based on being a person of color who is also a trans person, what is the best doctor that I can go to that's going to understand my experience? You can also ask if you have, a trusted doctor, like your primary care, who you do trust, that understands you, where would they recommend you go? Another really cool thing, if you don't have a friend network, a lot of LGBTQ folks potentially don't have a community that they can ask. Searching for LGBTQ Cleveland on Facebook and making sure to look in the groups section. And potentially there would be a like, sometimes they're called like a queer exchange, or just like LGBT Cleveland or something like that, where it's specifically a group for people to join, ask for recommendations, whether that's doctors or that's place of employment. In Columbus, there's actually a queer and trans Columbus housing and employment network, where a bunch of queer folks who are in the area join that group, and say, oh, my area, great place to live, very affirming, there's a apartment rental that's coming up, or I need a roommate and I also would like an LGBT roommate. So just really cool stuff where you're not going to find that by Googling. Also, Reddit is a great place to search. Just again, simple Google searches, places to live, LGBT, Reddit, Cleveland. Another just widely accessible place to receive care is Planned Parenthood. Not all Planned Parenthoods have doctors who prescribe gender affirming hormones, but any Planned Parenthood, they are very committed to LGBTQ affirming care. You can get STI testing, you can get usually preventative care, might not be able to get prescribed hormones, but great place to get that care. Just some examples of affirming clinics in Cleveland and Northeast Ohio. Metro Health Pride Clinic has been around for, I want to say, like 12 years now. I thought I saw an article earlier when I was looking up for this presentation. They have multiple locations. They even have folks who are doctors and provide care through the LGBT Center of Greater Cleveland, which is located in Gordon Square. So multiple locations, really great people. They offer hormone care and surgery. Cleveland Clinic Center for LGBTQ Care, main locations in Lakewood. They also have specialists at various locations. Also a place where you can get hormones and gender affirming surgery. Great providers at both of those. University hospitals, I don't know, I don't have any personal experience or many clients who have gone to them except to go for gender affirming surgery, but they do also have gender care services, hormones, and gender affirming surgery. So great places. Summa Health, actually, in Akron, Ohio. This is somewhat new, make it in the past couple years, 3 years. They now have a pride clinic for LGBT folks. They don't offer gender affirming surgery, but they do offer hormone access. And I do have patients, clients who have received care there and been very happy with that. So kind of a cool thing, you know, Akron folks, Summit County folks not having to drive all the way up to Cleveland to get that care. Planned Parenthood, these are the locations that offer gender affirming hormone therapy. So there are multiple other locations, but these are the specific ones where you can get prescribed hormones. You know, even in the Warren, Youngstown area, Kent, again, these kind of locations that it's going to be pretty far for folks to travel up to Cleveland, but that there's care that they can receive there. Some of the things about, okay, so we talked about, like, you know, getting unaffirming care, but how to get the medical care that you deserve at the doctors. Being honest about your experience. Our healthcare system was created around cisgender, heterosexual, white, educated, and relatively healthy individuals, which sounds a little bit weird, but, you know, I know a lot of folks who have had poor experiences because they have like a chronic medical condition or a chronic pain condition. And there's a lot of stigma around that of being drug seeking or something like that. So, you know, these people can be maybe quote unquote said that they're not very healthy because they have these chronic conditions, that it's not their fault that they're unhealthy, but it's hard to get good care to be able to receive or just, you know, feel better. So if you do experience something where your provider misgenders you or they use the wrong term for your body, if you feel safe to do so, tell your provider, you know, hey, you know, my pronouns are actually this, or that was a word that I don't use for my body. It is also okay to not say anything and decide that you would like to see another provider. You know, that's something that is more than okay. And you deserve to feel safe when you're getting care. Something else, asking for what you need. Using certain words to describe your body parts and the care that you need for them. Maybe there are certain words to describe your chest or, you know, your lower areas that you feel safe using. So telling your doctor that, so then you can in that experience, you know, potentially not be triggered as you're trying to get care for that body part. Other examples, having a friend accompany you or asking for a nurse of a certain gender. Great things to be able to feel more comfortable. Specifically asking a friend to accompany you. I don't know about all of you, but oftentimes I go to the doctor and I immediately forget all of the questions that I wanted to ask. And so having a friend with you, a trusted person, or writing down your questions beforehand can help you, you know, advocate for yourself and get the care that you need. One resource of getting the medical care you deserve, knowing your rights. This is a website called healthcarebillofrights.org. It is put together by Centerlink, which is a network of LGBT centers throughout the United States, and with the Human Rights Campaign. That this is actually a card that you can get. I think that they will mail it to you for free, or you can print them out, of something you can put in your wallet, to remind yourself of what your rights are. You can kind of read them there. Right to be treated with equality and respect. Something else, right to visitation by anyone you choose. So being able to advocate for your partner to be able to come and see you when you're in the hospital. And I think that that's a really great thing to just kind of have in your wallet and remember. That website kind of goes into detail about what each of those rights mean. So it can be helpful to kind of put it in context. So we're going to move on to mental health here for a little bit. How would you know if your therapist is transphobic or homophobic? So I have clients, that see me who said at the beginning, I didn't really know like what the red flags were for if this person was not treating me correctly and had bias. So thought it might be nice to just kind of go over those things. So this is taken from an article, and some of the themes, like I was talking about earlier, like what experiences do LGBT people have, and how can we frame them in a way that we can understand some of these themes? So educational burdening, inflation, narrowing, avoidance, generalizing, pathologizing, and gatekeeping. I'll go into those here in a bit. Educational burdening is the first one. So relying on the client to educate the therapist on queer and trans issues. I hear this a lot from clients, which is unfortunate, of I'm actually paying my therapist to be able to help me, but I'm also spending 2 or 3 sessions just explaining to them what being non-binary is. And so it actually takes the client out of the client role and into the role of an educator. And so then, I think one of my clients was like, so shouldn't they be paying me for that hour? I'm like, yeah, that's a good way of putting that. This happens in healthcare also. But again, spending a whole session educating your therapist about what being non-binary means when you really want to get help for potentially depression, or potentially you want to get help understanding your non-binary identity. But if you have to spend time educating your provider about that in the first place, there's a pretty you're pretty much filled with doubt that that therapist is actually going to be able to help you do that. Another category is called inflation. So overlooking important aspects of a queer or trans client because of their gender or sexual identity. So example, this is taken as a quote directly from the article. If I'm going to somebody for anxiety, all they want to do is talk about how it must be because I'm trans, how that must be the cause of all my problems. And that's very frustrating. So, you mentioned to the therapist, yes, I'm trans, but I'm feeling very secure in my identity and don't really want to talk about that. I actually want to talk about childhood trauma, or I actually want to talk about depression. But the therapist keeps going back to, well, what if, this is related to being trans? And are you sure that you have your identity figured out? Maybe we should spend some time on that. So can lead clients to really feel like they're not being viewed as a whole person, right? Like I have all of these other needs. I have all of these intersecting identities and experiences. I don't actually want therapy for my gender identity right now. But that's a common experience. Another theme is narrowing. So applying preconceived or restrictive notions of gender and sexuality onto clients. So this is actually a very common one. So it's where there's a therapist who is assuming, sorry about that, that there's a right way and a wrong way to transition. or to explore or express their gender identity. And so, example, therapist having a very narrow and formulaic view of sexuality, convincing a client that they can't be bisexual, but are just like closeted as a gay person. When that bisexual person knows, no, like I know my identity, I know that I'm attracted to more than one gender. I'm not actually closeted as a gay person. But through that therapy, right, you're in this experience of a power dynamic of you go to a therapist because you're seeking help from them. And so if that therapist is being like, well, actually, a lot of my clients that I've worked with, people who come out as bisexual, they always end up coming out as gay afterwards, can really sway that person's experience of themselves, and not allow them to fully explore or express their identity. Another category is avoidance. So in contrast of what we were talking before, lack of focus on issues of gender and sexuality. It can often reflect lack of training on the therapist's end. A quote from the article: I feel like trans people have two options. They either find a therapist who knows how to do trans stuff, but might not be good at whatever other mental health issues they have going on, or they find a therapist who can talk about the mental health problem and you can't understand what it means to be transgender. So, it's also kind of a subtle thing, but, trying to explain to someone, okay, so maybe example in my personal life. The experience of going to the men's public restroom for the first time. Horrible experience. Don't actually recommend anyone do that. Um, but there is fear that I have of going into the restroom of how I'm going to be perceived. And I have anxiety about that. So trying to talk to a therapist about that, and they're like, I don't understand why you're nervous about that. Maybe this is just about your generalized anxiety about going in public places. No, that's not actually what it's about. It's about, worried about safety issues of someone, finding me out or saying mean things to me, um, uh, you know, because I'm in that restroom and being perceived a certain way. Generalizing, making assumptions that all queer or trans clients are the same. Again, kind of related to earlier, an assumption of a universal narrative in the experience of gender and sexuality, as well as the process of affirming one's identity. That second part, right? There might be someone who believes that all trans people, in order to be real trans folks or to, be really affirming of their identity, have to seek gender affirming hormones. And that therapist might have some sort of bias of, oh, you're not seeking hormones, like you must not really be trans or you must not really be non-binary. Um, Another example, so a client is dissociating during a session when a therapist was making an assumption that all real transgender people have known that they were trans since they were a child. So the client then internalizes that negative belief and stops exploring their gender exploration of this therapist is a very narrow, narrow and kind of generalizing experience that everything is the same of all trans people must have known that they were trans by 4 years old. If you understand yourself as trans, later in life, you must be faking it, or, there must be something else going on. That can really cause people to internalize those beliefs and potentially stop in exploring their gender, right? They're like, okay, well, I guess I haven't always known, so I guess that's not really a path for me. Um, Pathologizing. So this means stigmatizing LGBTQ identity as a mental illness to be fixed or treated, um, or the cause of all problems. So it contributes to a sense of deficiency in your identity, feelings of shame, internalized self-beliefs, negative self-beliefs. This is where reparative therapy, which is illegal in Ohio now, thankfully, which is a harmful therapy to attempt to change clients' LGBTQ identity to the dominant norm. So it's often very religious based, but it's seeing, people as mentally ill and saying, this is the thing that needs to change in order for you to live a fulfilling life. Example, clients told by their therapist that being trans is a mental illness, and that is why you're depressed. Like that's the sole reason why you're depressed. So the client internalizes that, feeling bad and shameful, instead of the reality that trans people experience more depression because they live in a world that is discriminatory and hostile towards them. That's something that I say all the time when I'm, providing education about the higher rates of depression, anxiety, suicidality within the LGBT community. It is not because they are trans, it is not because they are gay that they experience more depression. It's because of how the world treats them. And that is why those disparities exist. Something that not a lot of people know of, right? Not until 1987 was the was homosexuality taken out of the DSM-5. DSM-5, or DSM just in general, excuse me, is the Diagnostic and Statistical Manual of Mental Disorders. So this is some people refer to as the Bible of diagnosing mental illness. And until 1987, that is not that long ago, homosexuality was included as a mental illness. And so thinking about that and thinking about, just how those biases can infiltrate care, I think is a really important context to remember. This is kind of a timeline of how LGBT has been included in some way in the DSM. In 1980, they actually introduced what's called gender identity disorder, which if you think about it, is a very stigmatizing view of, categorizing trans folks. And not until the DSM-5 was that gender identity disorder reevaluated and put into and named as gender dysphoria. So not hopefully, this idea that your identity is disordered, but that you experience dysphoria about the incongruence between your body and your gender identity. In the ICD, I'm not exactly sure what ICD means, but it's the coding of how you bill for insurance. And the ICD-10, which is the one that is still used, trying to transition to the ICD-11, we in the ICD-10, there's transsexualism and gender identity disorder of children. And it's also in the mental and behavioral disorders chapter of the ICD. Now there is a movement, and hopefully we're transitioning to that soon, of instead of even gender dysphoria, categorizing it as gender incongruence, and moving that into a category of conditions related to sexual health. So that is a really great movement in the right direction of destigmatizing and depathologizing trans identity. It's just that we haven't quite caught up to that yet. Insurance companies haven't quite caught up to that yet. Hopefully soon. And then finally, gatekeeping. So an over focus on controlling access to gender affirming medical care, requiring unnecessary and unfair steps, delaying care without a clear health-based reason, or watchful waiting. So an example of this, which best kind of describes this. Client goes to a therapist for the specific purpose of getting a referral letter for surgery. The therapist is unclear about how many sessions are needed before the letter is given and makes the client go to a psychiatrist even for multiple sessions of psychological testing. So that delay of care, when that person is like, I know my body, I know what I need, to affirm my identity. Going through the process of, I know that I need a mental health care letter, but not that process being not clear at all about what they need to do to get that letter. So you're spending money, co-pays, or potentially paying out of pocket for multiple sessions before this letter is given. But also this therapist is like, you actually need to go through very intense psychological testing to get that letter. I've absolutely had clients experience that before. So gatekeeping, kind of, symbolized by those gates up there, where the gates are shut and the therapist is the one who is shutting those gates because they need that mental health letter to receive gender affirming medical care, whether that's surgery or hormones. So just to talk a little bit about the experience of, needing these mental health letters to get gender affirming medical care. World Professional Association of Transgender Health is abbreviated as WPATH. They are a worldwide organization that creates these standards of care. So clinical guidance for professionals to assist clients with safe and effective pathways to achieving lasting personal comfort with their gendered selves. That's the language that they use. This has guidelines of the criteria of what is needed for folks to get gender affirming surgery, what the criteria they need to meet. Do they need a mental health letter for that? Also contains just like general information about the incidences of mental health and other areas of disparities. Right now they're on version 8, which was came out in September 2022. However, insurance and surgeons are mostly still abiding by the version 7, which came out in 2012, which says you have to have at least one mental health letter from a specific mental health professional to obtain surgery. WPATH, these standards of care are public. So if you Google WPATH standards of care, you can look at this PDF document. What's a WPATH letter? That's what some clients refer to them as. It's a letter written by a mental health provider after a mental health evaluation of a client to recommend them for gender affirming surgery. What letters are meant to do, right? They're meant to ensure that patients are optimal surgical candidates, which even in of itself, I put that in quotation marks because who gets to decide what an optimal surgical candidate is? Are these requirements, actually needed? And surgeon to surgeon, they can, decide whether you're an optimal candidate or not. It's also meant to establish the diagnosis of gender dysphoria and thus the medical necessity of surgical interventions. This letter is for, to prove that medical necessity, often to prove why insurance needs to cover this or why this person basically deserves to have surgery, which again is just kind of a backwards idea. And to ensure patients are mentally and socially prepared for surgery. That last part, I think, is the most important part. And I'll kind of explain to you, what could an affirming letter session look like? And it includes that last bullet point a lot. What happens during a letter appointment could be anywhere from 1 to 5 or more sessions to even get a letter from a therapist. Again, there might be some unclear expectations of how many sessions are needed. Just, okay, well, we'll meet, not sure how many sessions, but eventually you'll get your letter. You're asked a series of detailed questions about your gender history, what you want, why you want the surgery, mental health history, your plan for aftercare. This is maybe one of the most common experiences. Clients may feel a need to hide certain parts of their stories or fit into a common narrative of transition. Maybe they don't disclose that they're non-binary because of the need to appear that they are a binary person who is transitioning in a very binary and fits into this box kind of way. Maybe they don't share that they're actually kind of nervous about surgery and want to ask some questions, but don't want to appear like, I'm not fully ready for this surgery. Common thread, needing to prove your gender and why this surgery is needed. Again, just bad experiences of stigma and the process assuming that a trans person doesn't know their own identity or their body. I won't spend too much time on this slide, but if you can just see the length of this is all from a popular surgery center in California, which is called the Crane Center. This is what they require in mental health letters that has to include all of the following. A lot of this is taken from insurance companies as well. Usually insurance companies have this long of a list of requirements of what is needed in that letter. And a lot of this is taken from the WPATH standards of care, the version 7 and version 8. The requirements are much more limited and kind of more vague. But just trying to imagine all of these things, kind of besides these top 3 things that you kind of need to prove, and working with your therapist to get this letter means having to prove all of that. Experiences of the letter process, there's 2 primary themes of client experiences. BS, which stands for the swear word that I'm not going to say. This is some people's experiences of the letter process, that it's burdensome, that it's causing unnecessary barriers and threatening the therapeutic alliance or potential benefits of therapy. They have an experience where they're like, this was not affirming whatsoever. There's all these barriers. I have to go through this psychological testing. I have to answer 5,000 million questions. I have to tell the therapist, what childhood toys I played with to try and prove that, I've known my gender for years and years and years. The second theme, which is the theme that I tend to go to because I do provide letters for clients, is a blessing. So the process actually being where it's not about proving your gender, right? But it's about facilitating connections to affirming therapists. So this person is connected finally with an affirming therapist who does this letter process with them, who validate their identity, who provide resources to help them navigate the surgery process. Again, not about proving your gender, but so what can we do to make this experience the best experience for you? So this is kind of my checklist of what letter appointments could look like if therapists really understood all of the factors that would make this an affirming experience. Above all else, the therapist being a navigator and a facilitator, focusing not on the client needing to prove their gender, but how to work together to make the surgery process the safest and most effective. Informed consent model, meaning you have all the information to be able to make a decision about whether surgery is right for you. That's all that informed consent is. And that is my belief of what this process should look like. Oftentimes, actually never have I encountered a client who hasn't done hours of research, watched YouTube videos, talked with other people who have went through this surgery. They know what they're getting into. And potentially they've already had their consultation with their provider anyway. A lot of times, actually, my experience in providing mental health letters for people who are in Ohio, almost every surgeon requires a letter before the consultation even happens, which in my opinion is very backwards because, this person doesn't actually know what the surgery could look like for their body, but they're still being asked to prove that they need this. Anyway, helping the therapist can help to answer questions about insurance, time off from work, financial, practical questions, helping clients prepare for emotions before, during, and after surgery. And above all emphasizing bodily autonomy and that the client is the expert of their own experiences. Let's see. I'm going to kind of skip through this a little bit because I want to get to the resource section. I want to have enough time for questions. I also have a lot of content in this presentation, so we'll kind of like go by ear and see what we include. Basically, you have the right to seek an affirming provider. You have the right to change therapists who are, if they're not affirming of your identity. Here are a couple resources of online directories of where to find affirming therapists. So there's the National Queer and Trans Therapists of Color Network. It's an organization, online directory of therapists who identify as queer and are also either queer or trans people of color. So for queer and trans people of color who are clients, being able to be, connected with someone who shares their identity can be a really affirming thing. Inclusive Therapist is another online directory of social justice oriented therapists. They have to be vetted to be listed. So like in order to be listed, you have to explain why your practice is aligns with social justice values, why, you understand and can help clients navigate systems of oppression. So really cool resource. Most common resource in finding a therapist is Psychology Today. So I wanted to include this just because this is what people are going to be searching on and really help them walk through this experience. So in psychologytoday.com, you're going to type in your zip code at the top. And then once you have these therapists that are listed, you can go into this tab up here where it says issues and transgender. You can select if you're looking for a transgender oriented therapist, then you can select there. There's also underneath more, you can select people who serve LGBTQ plus people. There's an option for lesbian, bisexual. You can select the gender of your therapist as well. So those are ways to sort based on this massive resource that most people are going to use to find therapists, how to potentially find someone who is affirming. Doesn't mean they're actually going to be affirming. So I encourage you to ask questions that, it's your role is also to interview the therapist that you are going to see because you are paying them and they deserve to be the best person to help you. Another resource is called OpenPath Collective. This is a membership network, so you do have to pay a one-time fee of $65. That's how they are able to keep this directory going. And then for people who are uninsured or underinsured, you can see a therapist for $40 to $70 a session. There are therapists who agree to be part of this network who are specifically dedicated to providing lower fees for therapy services. Asking for a free consultation before your first session. This is something that's really important that you can always ask for. You can ask for a phone consultation. Some people do video consultations, asking, do you provide a free consultation so I can ask you if you are a good fit for me. If a therapist doesn't offer them, you're also allowed to ask why. And yeah, here's some questions to ask during your free consult. We'll share these slides with you so you can see those. And then finally, we're going to get to the resource section. One of the first resources I share with people is trying to find online community. And for folks who come and see me, they're like, I want to see, examples of surgery from my specific surgeon or connect with people who have had gender affirming surgery. The first group that I share with them is this Top Surgery Facebook group, has like 45,000 people in it or something. People share their experiences with insurance. They share their results. And also there are just a lot of resources on Facebook, all different types of communities. I found this one, which is really cool, Dungeons and Diversity, trans men, non-binary and women, D&D community. Lots of really cool different groups that you can connect with community. Also Reddit, tons of subreddits for everything. Searching, just in Google, again, keyword, so LGBT plus Reddit, you can connect to a bunch of different Reddit communities. I really liked the r/gamers. I thought that was really clever and cool. Social supports. I don't know how many folks know of Discord, but this is what Discord looks like. It's an app and a platform that you can have either on your phone or on your computer, which is a platform for people with similar interests to share and communicate over voice, video, and text. Most of the time it's text chat. Each of these little bubbles with a little avatar is a person. You can have your little profile picture. You can have whatever display name that you want. A lot of times it's an opportunity for people to explore different pronouns, to explore different names. So you have to find a group. And oftentimes, if you just search for LGBT Discord servers, then there's websites that kind of list public Discord servers that you can join. And there's different categories. So like there's different channels. Sometimes people are sharing memes or funny pictures. Sometimes there's a specific channel for trans men to talk. It's an amazing resource for people to be connected. Always recommend Discord. It's very popular in the video game community since you can stream your games, but there's also just specific LGBT focused servers and really anything that you can think of. I'm in a lot of Pokemon servers, as you can see in my background. I have the Pokemon plush back there, so that's pretty cool. Another really cool resource is this pronoun dressing room. So again, it'll be shared these slides, but where you can put in a name that you want to try out or pronouns that you want to try out, you submit the changes, and then it puts those into sentences. And you can just see what it's like for someone to potentially use that name or use those pronouns. Really, really awesome way of exploring identity. This is Centrelink. So this is a website where it lists all of the LGBT centers in Ohio. The LGBT Center of Greater Cleveland is there. Stonewall Columbus, which is where I'm from, Columbus, there's their website. So other locations throughout Ohio as well. Trevor Project, a lot of people know about this one. It is for young LGBT people, I think under the age of 24 or younger, but they won't turn away anyone who isn't a youth. So if you do need that 24-hour phone crisis hotline, you can call them. They won't turn you away. They might give you another resource, but LGBT focused crisis services, text messaging. There's also an online peer support community. The Trans Lifeline is one that I share with all of my trans clients. They're a wonderful organization, 24/7 peer support crisis phone hotline run by trans people for trans people. Something I like to discuss is that they have been divested from police since day one. A lot of hotlines employ what's called non-consensual active rescue, where they will send police or ambulance to your house without your consent. And that can be very dangerous for people, especially marginalized people, people of color. And so this is a peer support hotline where they will not send crisis services to your place unless you ask for that. Really, really awesome organization. They also have a list of other hotlines that are also divested from police and active rescue. The Gallup is a directory of therapists who have committed to offering at least one free letter per month for gender affirming surgery. I connect people to this resource all the time. So this is pro bono care that therapists have signed up to do. Some people might only have a certain number of slots per month, but really great to connect with people who are offering these letters free of charge. PFLAG, amazing community, stands for Parents and Friends of Lesbian and Gay Individuals, also LGBTQ plus in general, mainly for supporting, loved ones who have someone who is LGBT in their life, but also local chapter meetings. There's a lot of people who go who are specifically the LGBTQ plus identified person. They have a lot of publications. Our Trans Loved Ones is a PDF document that is one of the things that I share with a lot of loved ones of trans folks. Puts it in layman's terms, really, asks the questions maybe that you're afraid to ask about how to understand trans folks. Really, really awesome publication. They also have this new thing. It's like an online academy where they have recorded sessions of like Trans 101 or like how to advocate for LGBT inclusivity in your school that are recorded sessions online. So really cool resource there. This is from the ACLU, a bill tracking website. If you scroll down to on this website, Ohio, you can see all of the specific bills that are anti-LGBTQ and click on them to then potentially engage in action for your legislators, understand these bills more. Great way to advocate on behalf of LGBTQ people. This is another resource that is specifically by the National Center for Transgender Equality. They also list the different anti-LGBT bills. This specific bill, which is quote unquote the trans youth sports ban, you can click on this link and then it actually brings you to a messaging system where you can send a message to your lawmakers to advocate on behalf of trans youth. Really cool resource. Also, this website includes just a bunch of blurbs about your rights as a trans person, all in one place. Really cool. Transgender Legal and Defense and Education Fund, they have a roadmap, like a video series of how trans people can learn how their health insurance works and how to identify if they do have health insurance coverage for trans-related care. I give this resource to every single person who comes to me for a letter so they can understand, what their coverage is. More health coverage guides about learning what your plan covers, pre-authorization template letters if you want to advocate for yourself and also send a letter on behalf of yourself for why you need this surgery or this care. On my website, I have a guide of verifying your gender affirming surgery benefits. There's a link there, a script to ask your health insurance company because it's hard to, call the insurance company and then actually know what to say to get what you need. This is a resource for helping to find a trans inclusive marketplace Obamacare plan. They have different PDFs of the specific Ohio insurances and insurances throughout the United States, what kind of coverage they have for gender affirming care. Also really cool. This is a patient how-to guide, someone who was non-binary, is non-binary, who's not on testosterone. Ohio does not have a specific law that provides trans inclusive health protections. Unfortunately, plans are able to exclude coverage if they want to. However, this person did get their surgery covered because they went through an appeal process, they have templates for how they went through this appeal process, and what they put in those letters that someone else can potentially use if you're trying to appeal an insurance denial. And then finally, this is a health insurance literacy worksheet, again, kind of on the same lines of coverage for trans-related care. And then I have a lot more slides, but we're going to kind of end there. I have my references in here if you need to, if you want to explore more of these references. And that's about it.
Thank you so much, Emerson. This has been so informative. And I know I've received a few questions in the chat. Yes, you will receive these slides. I will make sure they are made available to you all. I will send them in an email shortly after today's webinar. We do have, if anyone has any questions, feel free to drop those in the chat. I did get one question while you were presenting, Emerson, and that was a question around if you're aware of any efforts or current resources around LGBTQ specific emergency housing or shelter, or any specific behavioral health units, for example, for LGBTQ identified individuals.
I am not sure of the resources in Cleveland. Let's see. I think, let me look up. I'll share it on my screen if I can figure this out. I think there's something in Columbus. Yeah. So can you see, like, if I Google something here?
Yes.
Okay. So Star House Columbus is one of the only resources that I know of that's specifically for LGBT youth experiencing homelessness. They have like a drop-in center, and also they work with the Columbus Metropolitan Housing Agency to help folks find affordable housing. So that's one of the only resources that I know of. Unfortunately, homeless shelters can be a very non-affirming place for folks to be who are LGBT. But potentially, if you reach out to Star House, they might have some resources for other areas of Ohio.
Thank you. Not seeing any more questions, so I am going to drop in the chat the link for the survey for this presentation. If you could complete that, I would appreciate it. I'll also send the link to the survey in the email that I will send with the slides. Oh, looks like we have one, B. Riley's for substance abuse. Thanks for sharing that in the chat. Just also for everyone on this call, NAMI Greater Cleveland does offer 2 support groups, which are free and open to the public for LGBTQ identified individuals. We have the Kaleidoscope Crowd, which is a group for adults over the age of 18 who are LGBTQ identified. And we also have the Rainbow Pioneers, which is a support group for 50 plus older adults who identify as LGBTQ. So I'll send information about how you can find out, how you can look at our current support group offerings on the calendar of our website in the event that you are interested in attending one of those groups, or you may want to refer some clients or some patients to those groups. Thanks. Just see more folks sharing some resources related to the disenfranchised and homeless LGBTQ youth. So thank you, folks highlighting Belfair JCB. Always can call phone 211 also for connection to community resources. Thanks for sharing that. If we don't have any other questions for Emerson, I think we will end the webinar. Again, complete the survey for me when you have a moment. And thanks all for being here. And thanks, Emerson, for such an informative presentation.
Thank you. It's great to be with you all.
Have a great day, everyone.